potential contribution of some of the SSRI drugs. And
is there a relationship between SSRIs and mass shootings? I'm Dr. Merholm, a board-certified psychiatrist and assistant professor of psychiatry at Columbia, and I'd like to explain this a little bit. Because it's easy to just say, no, there isn't. There's no data to show that. That's not what the black box warning is. There's no reason to think this. And then move on. But what I realized in speaking with people who believe this is that this needs a conversation anytime we're having a disagreement about something. And there seems to be some clear scientific fact on one side. Just hitting somebody over the head with science and saying, you're wrong, you're lying, that's not true, doesn't work. When we explore a little bit, why does someone think this way? Here's one reason. Is there a correlation? Yes. When you look at people who are perpetrators of mass shootings, is there a correlation? Meaning, is there some relationship between somebody who has committed this violent act and having been on an SSRI? Oftentimes, yes, there is. Well, now, what do I make of that correlation? This is like saying, we've seen that people who step outside for a cigarette tend to die of lung cancer. So we should say people who step outside are more likely to die of lung cancer. We should ban stepping outside or look into this idea of stepping outside. We would miss that the issue here is smoking that's causing lung cancer, not stepping outside. This is the difference between correlation and causation. The correlation of somebody using an SSRI is because there's an underlying mental health issue. There's somebody who is depressed. There's somebody who needs treatment. So we shouldn't be looking at taking away the treatment of depression. We should be looking at saying, you have people who are being diagnosed with depression, anxiety, and other things, and all they're getting is a medication, and medication alone is not sufficient. I say that as someone who prescribes medication every day. If we can understand the difference between correlation and causation, if we can understand that if someone's on the other side saying, you know what, maybe the meds are the problem, maybe the meds are the ones causing all this, so that we can have a better dialogue. Instead of just saying, no, you're wrong, and here's the science, or here's the facts, we need to be able to listen to each other and understand we both want the same thing, right? Nobody wants more mass shootings. Nobody wants more mental illness. We want things to be better, but in the process of so doing that, we can't throw the baby out with the bathwater. We can't take away the treatment that's actually helping mental illness in the search for treating the underlying illness.